Dgroups, an established entity since 1999, has solidified its presence in the South Asian region, in Andhra Pradesh, with Hyderabad as its capital. And Pan-India Service. We specialize in occupational health center, OHC, services, comprehensive sales, and service of medical equipment, as well as offering cutting-edge lessing services.
And accessibility. Pan-India presence. With a robust and expansive presence across the length and breadth of India, Dgroups has established itself as a key player in the healthcare ecosystem. The company's strategically located offices and distribution centers enable seamless access to its
magnetic resonance imaging. MRI is a medical imaging technique that uses strong magnetic fields and radio waves to generate detailed images of the internal structures of the body. It provides a non-invasive way to visualize soft tissues, organs, and other internal structures with great clarity. The invention of MRI can be attributed to multiple scientists over the years. The foundational principles of MRI were developed independently by Paul Lauterbur and Sir Peter Mansfield. Paul Lauterbur, an American chemist, introduced the concept of spatial encoding in 1973, while Sir Peter Mansfield, a British physicist, contributed to the development of fast imaging techniques. Their work laid the groundwork for the development of modern MRI technology. The first human MRI scan was performed in 1977 by Dr. Raymond Damodian, an American physician, and his colleagues. They used a machine called the Indomitable, which is considered the first whole-body MRI scanner. Uses of MRI. Diagnostic imaging. MRI is widely used for diagnosing and monitoring various medical conditions, including neurological disorders, joint and musculoskeletal issues, cardiovascular conditions, and tumors. Research. MRI is employed in research studies to understand the structure and function of different organs and tissues in the body. Disadvantages and precautions. Contrast agents. Some MRI scans may involve the use of contrast agents to enhance image clarity. Allergic reactions to these contrast agents are rare but possible. Metal interference. The strong magnetic fields used in MRI can cause certain metallic objects to become projectiles or heat up. Patients are typically screened for metal implants or objects before undergoing an MRI. Pregnancy. While MRI is generally considered safe during pregnancy, it is typically avoided during the first trimester unless absolutely necessary. Cost. The cost of an MRI scan can vary widely depending on factors such as the type of scan, the location of the facility, and whether contrast agents are used. In the United States, for example, the cost of an MRI can range from a few hundred to several $1,000s. Health insurance may cover all or part of the expenses, depending on the policy and the medical necessity of the procedure. Costs in other countries may vary based on healthcare systems and local pricing structures. When undergoing an MRI, magnetic resonance imaging, scan, there are certain do's and don'ts that patients should be aware of to ensure the safety and effectiveness of the procedure. DOS. Follow pre-scan instructions. Adhere to any specific instructions provided by the healthcare facility before the scan. This may include dietary restrictions or the avoidance. Remove metal objects. Before entering the MRI room, remove all metal objects, including jewelry, watches, hairpins, and hearing aids. Some clothing items may contain metallic elements, so you may be asked to change into a gown. Answer questions honestly. Be honest and thorough when providing your medical history. Inform the healthcare team about any metal implants, devices, or prior surgeries. Stay still. During the scan, it's essential to remain as still as possible. Any movement can affect the quality of the images. Follow the instructions from the technologist on when to hold your breath or stay still. Use ear protection. MRI machines can be loud, so ear protection, usually in the form of headphones or earplugs, may be provided. Using them helps minimize the noise and protect your hearing. Communicate. If you experience discomfort or anxiety during the procedure, communicate with the technologist. They can provide support and address any concerns. Zippers, or buttons into the MRI room. Metal can interfere with the magnetic field and compromise the quality of the images. Bring metal objects. Leave metal objects such as keys, coins, and electronic devices outside the MRI room. These items can become hazardous in the strong magnetic field. Eat or drink before certain scans. Some MRI scans, particularly those involving the abdomen, may require fasting for a few hours before the procedure. Follow any dietary restrictions provided by the healthcare team. Ignore claustrophobia concerns. If you have concerns about claustrophobia or anxiety, discuss them with your healthcare provider beforehand. They may offer solutions such as open MRI machines or relaxation techniques. Assume all MRI machines are the same. There are different types of MRI machines, including open and closed systems. If you have a preference or if you experience anxiety, discuss this with your healthcare. There are several types of MRI, magnetic resonance imaging, scans, each designed to provide detailed images of specific areas or structures within the body. The choice of MRI type depends on the medical condition being investigated. Here are some common types of MRI scans. T1 weighted MRI provides detailed images of anatomy. Used for imaging the brain, spine, muscles, and other tissues. Differentiates between normal and abnormal tissues based on their water and fat content. T2 weighted MRI emphasizes the visualization of fluid-filled structures. Useful for detecting abnormalities in the brain, spinal cord, joints, and soft tissues. Highlights differences in water content between tissues. Functional MRI, fMRI, measures and maps brain activity by detecting changes in blood flow. Commonly used in neuroscience to study brain function during various tasks. Helps identify active regions of the brain in response to stimuli. Diffusion-weighted imaging, DWI, evaluates the movement of water molecules in tissues. Used to detect abnormalities such as tumors and strokes. Provides information about tissue cellularity and integrity. Perfusion-weighted imaging measures blood flow to tissues. Useful in assessing blood supply to organs, particularly the brain. Helps identify areas with reduced blood flow, which can indicate disease or injury. Magnetic resonance angiography, MRA, focuses on imaging blood vessels. Used to visualize blood flow and detect abnormalities such as aneurysms or stenosis. Commonly applied in imaging the arteries of the brain, neck, chest, and extremities. Magnetic resonance venography, MRV, specialized for imaging veins and venous structures. Often used in assessing blood flow and identifying venous abnormalities. Applied in imaging the brain, neck, and extremities. 3D MRI acquires volumetric data to create three-dimensional images. Offers enhanced spatial resolution. And cardiac MRI, specifically tailored for imaging the heart and surrounding structures. Provides information about cardiac function, blood flow, and tissue viability. Assists in diagnosing heart diseases and planning treatments. Breast MRI, used as a supplementary imaging tool for breast cancer diagnosis and staging. Provides detailed images of breast tissue, especially in dense breasts. Often used in conjunction with mammography and ultrasound. However, as of my last update, some well-known manufacturers of MRI machines include GE Healthcare. General Electric's healthcare division produces a range of medical imaging equipment, including MRI machines. Siemens Healthineers. Siemens is a global healthcare company that manufactures medical imaging and diagnostic equipment, including MRI systems. Philips Healthcare. Philips produces a variety of medical imaging devices, including MRI systems. Hitachi Medical Systems. Hitachi manufactures medical imaging equipment, including MRI scanners, for diagnostic purposes. Toshiba Medical Systems. Now Canon Medical Systems. Toshiba's medical division was acquired by Canon and is now known as Canon Medical Systems. They produce various medical imaging devices, including MRI machines. It's important to note that the prices for MRI machines can range from hundreds of thousands to several $million, depending on the model and features. Additionally, ongoing maintenance, service agreements, and other associated costs should be considered. For the most accurate and up-to-date information on MRI machine manufacturers and prices, it's recommended to contact the manufacturers directly or consult with medical equipment suppliers. They can provide detailed information about specific models, features, and pricing options based on your requirements. Magnetic resonance imaging, MRI, is generally considered a safe and non-invasive imaging technique. However, like any medical procedure, there can be certain complications or considerations associated with MRI. It's important to note that serious complications are rare, and the benefits of obtaining important diagnostic information usually outweigh the risks. Here are some considerations and potential complications. Contrast agent reactions. Some MRI scans may involve the use of contrast agents, gadolinium-based contrast agents, to enhance image clarity. Allergic reactions to these agents are rare but can occur. Symptoms may include hives, itching, or more severe reactions. Metal interference. The strong magnetic field in the MRI machine can interact with metal objects. Patients are usually screened for metal implants, devices, or objects before the scan to avoid potential hazards. Certain metal implants or devices, like pacemakers or cochlear implants, may pose risks and require claustrophobia. The enclosed space of the MRI machine may cause anxiety or claustrophobia in some individuals. Open MRI machines or the use of sedation may be considered for those who experience significant discomfort. Hearing damage. The MRI machine produces loud knocking or tapping sounds during the scan. Patients are typically provided with ear protection, such as headphones or earplugs, to prevent potential hearing damage. Pregnancy considerations. While MRI is generally considered safe during pregnancy, it is typically avoided during the first trimester unless absolutely necessary. It's important to inform healthcare providers if there is a possibility of pregnancy. Device malfunction. In rare cases, certain electronic devices or implants may malfunction or be affected by the strong magnetic fields during an MRI. This is why patients are screened for such devices before the procedure. Neuri from ferromagnetic objects. Objects containing ferromagnetic materials, for example, oxygen tanks, certain medical devices, can become projectiles in the magnetic field. Strict adherence to safety guidelines and screening protocols is essential. Discomfort or heat sensation. Some patients may experience mild discomfort or a warm sensation during the scan, particularly if they have metal implants. This is generally not harmful and is temporary. It's crucial for patients to communicate openly with their healthcare providers before undergoing an MRI, providing complete information about their medical history, allergies, and any implanted devices. This allows healthcare professionals to take necessary precautions and ensure a safe imaging experience. If there are concerns or questions, discussing them with the healthcare team is recommended. 3 types of MRI machines. Extremity MRI. This is a diagnostic imaging procedure that uses a closed MRI machine to look at the tissues in the arms and legs. Unlike a traditional MRI procedure that uses a large tube-shaped device, an extremity MRI uses a smaller scanner designed specifically for the body's extremities. This eliminates the potential for claustrophobia, which some patients experience when enclosed in a full-body MRI machine. A traditional MRI requires you to lie completely still, but an extremity MRI won't limit your body movements quite as much. One may undergo an extremity MRI to diagnose any of the following conditions in the arms, legs, hands, and feet. Arthritis, fractures, bone infections, tumors of the bone or soft tissue, nerve-related issues, stress injuries or injuries related to torsion or heavy impact. 3 types of MRI machines. Extremity MRI. This is a diagnostic imaging procedure that uses a closed MRI machine to look at the tissues in the arms and legs. Unlike a traditional MRI procedure that uses a large tube-shaped device, an extremity MRI uses a smaller scanner designed specifically for the body's extremities. This eliminates the potential for claustrophobia, which some patients experience when enclosed in a full-body MRI machine. A traditional MRI requires you to lie completely still, but an extremity MRI won't limit your body movements quite as much. One may undergo an extremity MRI to diagnose any of the following conditions in the arms, legs, hands, and feet. Arthritis, fractures, Bone infections. Tumors of the bone or soft tissue. Nerve-related issues. Stress injuries or injuries related to torsion or heavy impact. Open MRI. Open MRI machines also stray from the traditional design of the full-body MRI, which makes some patients feel anxious due to the closed-in nature of the machine. An open MRI is open on the sides or features wider openings, still requiring the patient to lie on a sliding table. Although an open MRI offers increased comfortability for patients suffering from anxiety or claustrophobia, it comes at the cost of producing less detailed images than its closed MRI counterparts because the open nature of the machine does not provide as strong of a magnetic field. 3 Tesla MRI. This type of closed MRI uses magnetic fields that have double the strength of a traditional MRI machine, thus producing an even more detailed image in less time. It is commonly used to identify the signs of stroke, tumors, or aneurysms in the brain, to examine the heart and circulatory system for damage resulting from a heart attack or heart disease, or blockages in the blood vessels, to look for conditions such as arthritis, disc disease, or bone infections in the bones and joints, or to analyze the state of internal organs like the liver, kidneys, uterus, ovaries, or prostate. As many as 30 million MRI scans are performed in the US each year, 6.6 million of which are head scans. Your physician will determine which type of MRI is best to diagnose your particular ailment.
Time to watch our content on Dgroups. Your support means the world to us, and we are thrilled to have you as part of our community. If you enjoyed what you saw, don't forget to hit that subscribe button. Subscribing ensures that you stay updated with our latest videos, updates, and exciting content. By subscribing, you become an integral part of our growing community, and your support inspires us to create more engaging and valuable content for you. Thank you for being a part of the Dgroups family. We look forward to bringing you more entertaining and informative content in the future. If you have any suggestions or topics you'd like us to cover, feel free to leave a comment below. Once again, thank you for your support, and we can't wait to share more exciting moments with you on Dgroups.